Bonjour tout le monde. Good morning. Is it good for the mic? Thank you very much, Geneviève, for the wonderful introduction. It's an honor for me to be here and to be with such a big group of social workers. We are few and far between in MSF, so it's been really interesting for me to see so many social workers from so many different backgrounds throughout the whole province. It's been inspiring, to be honest. So thank you very much for having me, for having flown me in. It's quite an honor, and I hope that you will enjoy my presentation. So I'll just give you a quick outline of what the presentation will be about. I'll be talking about what is MSF to start with, then what is the mental health interventions in MSF, the way we do it, through concrete examples of working in armed conflicts and natural disasters. I'll say a few words about psychosocial care in MSF. I think it's important to talk about that also. Then I'll give the example of where I'm currently working in New Delhi, India, in the sexual violence project we have there, which we just started last year. I'll try to wrap it up with the role of social workers, concretely what is expected and what the way that the role of the social worker, the mental health officer in MSF, and the criteria for working in the field with MSF, and then we'll conclude with a small discussion on the way forward. So how I became an MSFer. I really had to think about it. I had to go down the memory lane. Let's just start with social work. I come from a family of social workers. Mom was the first one to do her master's in social work from the University of Ottawa, and that, of course, inspired me a lot. And then I completed my master's, and I have also a sister who's completed her master's in social work, one that looks very much like me, and one of the participants thought I was her. So anyway, so it's in the blood, social work. And that's really nice. And of course, we all work in different fields. That's also what's incredible, because when I was young, I said, I'll never be a social worker like my mom. But you know, in the end, I mean, that's what is great about the profession, is that it can lead you into so many different fields. So I worked at the Ottawa Hospital in the emergency department as a social worker. And that fit my style very much. I really enjoyed working in that job. And one day there was a teenager had been shot in Lower Town, Ottawa, Somali teenager, and the family showed up in Emerge. The patient hadn't come to us, he had gone straight to the morgue, but I was asked to bring the family to the morgue so that they could see the body and be with their son. So I accompanied the family, and when we arrived at the morgue, the pathologist was there. The family went in. It was a very small room, so we decided to step outside because there were several of them and they were supporting each other. So I'm standing with the pathologist and we start talking, and this guy told me his story. He had just come back and he said to me, you know, this family is lucky because they have the body of their loved one. And I was like, oh yeah? So, which way? And he told the story. He had just come back from MSF, with MSF, from Kosovo, where they were digging graves, mass graves, and he was doing identification of bodies. And when he told me that, he drew the picture for me. There was a rope around, and all the family members were waiting by the rope to see, is that going to be my family member, my family member? And all I could think about was, wow, who was supporting you? Who was supporting these families? You know, what's that the name of that organization? MSF. So I kept it in mind. I was very touched by the work he had done. I could see that it had touched him a lot. And the next time I saw the little ad somewhere nearby the hospital where it said that MSF was presenting in the Faculty of Medicine, I thought, I'm going to go there and see what this is all about. So it led to that. I interviewed in Toronto. MSF was not hiring social workers really in those days, but I was very determined. I could see that I had the skills from having worked in the emergency department, having worked with trauma, with sexual violence. I'd worked also with the Ottawa Police as a crisis intervention counselor, and I figured that, yeah, this was going to be for me. I convinced them, they hired me, the rest is history, as the saying goes. So MSF changed my life. It didn't only change my life, it is my life, but it's also my family. So let me tell you the story. So let's talk about Doctors Without Borders. It's an NGO that was created in 1971. It's an international medical humanitarian aid organization that provides emergency care to people affected by conflict, disaster, epidemic, and in situations of neglect. In 1999, MSF was awarded the Nobel Peace Prize. The actions of MSF are guided by the medical ethics, and we observe the principles of neutrality and impartiality. That means that the decision to who we offer assistance is based on our own assessments in the field. We assess directly ourselves, and then we decide if an intervention is required and which intervention that will be. We offer assistance to people based on the need that we see, irrespective of race, religion, gender, or political affiliation. The decisions of MSF to intervene are not biased or based on political, economical, or religious reasons. We don't have any affiliations of this such. MSF works in 69 countries around the world. There are 5 big operational centers. It gets a bit complicated, but it started in France and it grew, and there are 5 big operational centers, one in Geneva, Barcelona, Paris, Brussels, and Amsterdam. That's the operational center for which I work. And then there are 21 main offices where MSF does recruitment, communication, and fundraising. So offices, you know, Italy, US, Canada, just to name a few. There are 21 of these offices. I'm going to show you a small video, and I think this will highlight very well what is MSF. So every year, MSF sends thousands of professionals to the field, and the big myth is that MSF only sends doctors and nurses. Well, I can guarantee you today that that's not the case. MSF also sends mental health specialists, logistical experts, engineers, administrators. And the way it works is that a small team of these specialists are in the field as the managers of the project, and the staff that does the direct intervention with the patients in the most of the settings are hired locally. So we arrive in a country, we hire the local staff, and we work with local staff, increasing their capacities, building their capacities. And so 90% of the staff in the field are national staff. Okay, and now let's get to specifically the topic of how we do mental health in MSF. So you saw in the video, one of the components is mental health. Definitely. Just to give you a small history, MSF started mental health. The first psychosocial intervention was in 1990 in a community-based program in Gaza. And since then, since the 1990s, I mean, mental health has been implemented in many projects in over 40 countries around the world. The way that we prefer to do mental health is as a community-based approach and is integrated. So whether we have a hospital, a clinic, a nutrition center for malnutrition, then the services are there also. So it's one of the services that are offered to provide care to the patient. So it's in the idea of a holistic approach. So you go, you see the doctor, and you'll also be able to receive counseling from a mental health counselor. Okay. Psychiatric care, sorry, a little bit too fast. Psychiatric care, however, just to clarify, is offered by the medical team. So there is, of course, you work in a collaboration. It's always a collaboration, you know, social workers, that's what we're all about, isn't it? So it's an interdisciplinary setting, so the medical doctors will medically treat, let's say, the psychiatric illnesses with the collaboration of the support of the counselor. But it's a separate component, and you could, for example, not have a big mental health component. You're running a clinic somewhere in Congo and definitely still treat psychiatric illness. The doctors can do that. was not always been like that. It's taken time for MSF to recognize that psychiatric illnesses should also be treated because, in the early days of MSF, we treated only everything that was emergency, not the chronic. But the view changed over the years with treating HIV, for example, which is chronic, which MSF started to do, and eventually also psychiatric care. So that's a big advancement, I would say, for MSF. The approach, I said it was community-based for mental health. It's based on the principles derived from brief trauma-focused therapy. The effort is, the goal is to reduce the symptoms and improve the functionality. We cannot provide the long-term counseling, and you have to remember that in the settings, you're not back to normal life and everything. So the settings are often continue to be or insecure, or it takes time. So we focus. It's a lot more practical. Plus, we work with national staff. In some countries, there is no psychology, social work experienced staff. So we're working with the basic skills here in many of the contexts. So the approach is actually, I find, is really like social work. The aim is just to help the people develop their own skills, reconnect with their own strengths, and to tap into their own resources. This is their country. They've experienced. They're with their community. So we're helping them to bridge, to make this link. That's the way that we work. So let me give you an example, a concrete example of working in an area of conflict. The example is in Chad. I will talk about the mission that MSF had in Chad, where we did an intervention this started in 2004. I'll talk briefly about the assessment that we did before we started the intervention, the actual mental health program. I'll touch briefly on an evaluation that was done of that program, and I'll end with the small video so it'll give you a little visual of Chad itself. Hey, what are you doing here? No, we're not on a safari. We're in Chad, in the desert of Chad. So just to help you, we are in Central Africa here, and landlocked country. It's northern Central Africa, Chad, and it borders with Sudan. And what's highlighted in blue here is the region of Darfur. So where we were based is just on the other side of that Darfur line, where what happened in Darfur is in 2003, there was a conflict in Sudan, in the region of Darfur, which we called the Darfur War. You might have heard that before. It started in 2003, and by 2004, there was a mass refugee influx into the country of Chad, 250,000. In those days, it was one of the worst humanitarian crises that the world had seen. And it also caused the displacement of 2 million people. And these are really difficult conditions we're talking about here. This is what the camp looked like in Chad. This was the living conditions. This area of Chad is just one big desert. The advantage, just to tell you the good thing about this area is that part of Darfur and that part of Chad, the population were the same. They came from the same tribe and religious background, and the Chadians on that side welcomed the refugees. That was a huge advantage, to be honest, but they couldn't bring them into their homes. This is an area of Chad where there's almost nothing. It was an empty kind of area because it's close to the border, and the border has always been insecure. So a camp was set up. So MSF went there in 2004 January and opened a clinic in the camp of Farshana, but the clinic was smart. It was set up just outside of the camp at the entrance, so that those who lived in the village nearby could also access, and those who came from the camp could access, so that it was accessible to both the refugees and the local population, because we're not kidding ourselves here. There was no healthcare